What is a bridge? It can be thought of as a structure that eases the way for travelers on their way to a destination. It may span deep, plunging valleys or dark, troubled waters, and without it, the traveler's journey would be much more difficult, if not impossible. Typically, the stability of a bridge depends on two strong supports working together. It is essential to the integrity of the bridge and the well-being of those they support. In very much the same way, the professional and home caregiver work together as they ease the way for a person with dementia. Daycare is a wonderful resource for people with dementia and their families. In this video, you'll be hearing about the benefits of adult daycare from both caregivers and professionals, and you'll be learning how to partner with the staff of your daycare center to provide the best possible care for your loved one. As you know, caregiving doesn't occur in a vacuum. People become caregivers in the midst of all their other responsibilities. To get a perspective on the benefits of adult daycare, we spoke with some actual caregivers. Joan is the primary caregiver for her mother, Natalie.
Is there a word bigger than monumental? Quite frankly, what it does is it allows me to go to work and not have to worry about what's happening at home. And considering the fact that I have lots of other stuff to worry about, that's one less thing to worry about. Yeah.
Barbara cares for her husband, Alan.
Attendance at daycare was helpful to me because it freed up some time for me. It was a very stressful period of time just to get him up and get dressed in the morning. And by the time I got him dressed and over here, it was like I did a day's work already. And so when I dropped him off, that was, as the commercial says, how do you spell relief? It was relief, because I had some time to myself to do some things that I not normally would be able to get done. And one day I just went to the movies.
Brenda was also caring for her husband.
It was extremely valuable to me on the level that when I went to work and I knew he was there and I knew someone, if anything happened, someone would call me, it relieved a lot of the stress and strain that I would have. Even if women are home, they just want to know they need that time for themselves.
Shirley and her husband have been married almost 62 years.
Security. I can go someplace. I always have a telephone with me, but I can feel free to go visit a relative or somebody sick, or I go to church one afternoon a week on, we have a service at noon on Wednesday, and I always know that he's safe and that he's being cared for, that there's somebody, with him.
Marianne is caring for her mother, but is also caring for grandchildren and going to work.
Well, while my mother's in daycare, most of the time I'm going to work. But I also get to run errands if we need to go food shopping, if clothes, whatever, I use that time while she's here.
But daycare is about more than providing a break for you. It's actually very beneficial for your family member. Activities are tailored to each individual's level of functioning, so they're fully involved and they experience success. The social stimulation and program of activities will help maintain skills, and research indicates that those who attend daycare have less behavioral problems at home and less trouble sleeping. The caregivers we spoke to have noticed other benefits as well. Joan's mother, Natalie, suffers from a very common symptom of dementia called apathy. People who suffer from apathy have no initiative. They spend a lot of time just doing nothing at all. The activities at daycare keep Natalie more alert and active.
If she was by herself, she would do nothing but probably sleep. So this is, and I notice the difference between the days that she comes and the days that she doesn't go. At the end of the day, she's I guess happier is really what it is. You know, she feels a little better about herself. I don't know. There is a difference in her.
Susan had been caring for her mother with Alzheimer's disease when her father, Frank, was also diagnosed with Alzheimer's. At the same time, she was working and caring for a very ill adult daughter.
It was something for him to do than just sit in front of the television. And he enjoyed his 6 hours a day here, pretty much. And you could see the difference even when he would come home. He would get sad because, you know, he got a lot of attention here. He had a lot of girlfriends in that program and the daycare program. So he enjoyed it.
Barbara felt that being with other people was good for her husband.
I think the single most important thing he got out of daycare was being with other people during the course of the day. It gave him an opportunity to be in a group where there were similarities, you know, to his behavior. And I think it made him feel a little more comfortable to know that he wasn't the only one in that particular situation.
Shirley's husband has been attending adult daycare for more than 17 years.
I really feel very strongly that the reason that he's as cognizant of things around him and all as concerned now is because of his attendance at daycare.
In order to understand why daycare is so beneficial, we need to understand a little more about dementia. Dementia is a very broad term. There are many different kinds of dementia that can affect a person in many different ways. When someone has cancer, we want to know, is it lung cancer, bone cancer, breast cancer? In the same way, if someone has dementia, we want to know, is it caused by Alzheimer's disease, Parkinson's disease, Lewy body disease, or is it a vascular dementia? Most people associate dementia with memory problems. But it's the other symptoms that make it even more difficult to cope with. Impairments in language, abstract reasoning, judgment and orientation make it hard to communicate and perform everyday tasks. And people with dementia often have delusions and hallucinations. They may think that people are stealing their possessions, or they may see small children or animals in the house. This image of the brain shows what parts of the brain are associated with different activities. When the brain is damaged in a particular area, the person will have trouble with those related abilities. Other areas of the brain may be left untouched, and related capacities such as humor, social skills, and appreciation for art and music may remain. We know that you're very aware of the changes in your loved one, and we understand how painful this is for you. While it's natural that you focus on what they cannot do, we focus on what they can do. That's the basis of our work, to use the strengths and abilities that each person still has to help maximize their functioning and make them feel better. We can enjoy who they are now, and we hope to share that feeling with you. But to do the best job possible, the daycare staff needs your help. Often people with dementia can't remember the most treasured details about their own lives. You know more about your loved one than anyone else, and your insight and knowledge is important. The staff will want to know about your loved one's interests, hobbies, what music they like, what television shows they enjoyed, or the name of their favorite sports team. They may ask about the kind of work your loved one did, their proudest moments, where they grew up, where they traveled, and whether they have any grandchildren. Telling the staff about things like this can be very useful. The more information you share with the staff, the better able they are to talk about these things with your loved one, which can increase self-esteem and contribute to an improved sense of well-being. This information will also help the staff develop meaningful activities. While it's important that you provide information about your loved one when they first come to the center, it's also important to continue to let the staff know what is currently going on in their lives.
These are people who get to know my mother differently. They know her personally. They know about what she did over the weekend. They'll ask me, what did she do over the weekend, so that they have something to talk to her about. And And I think that makes it better for my mother. I mean, she's more relaxed. She feels more familiar with them.
Some days, if I think he's had a restless night or something, or if maybe he ate something that didn't agree with him or something, I usually will let them know if anything out of order happened at home.
Sandy Egan, who is a nurse in a day program, feels this ongoing communication is important from a medical perspective.
As far as communication, families need to communicate to us about the physical and mental health of their patients, any changes at home, so that we can help assess what's causing these changes, whether it's a change in home health aid or a medication or a physical illness.
Caregivers should let their day program staff know about strategies that work at home. John used to get restless during lunch. His wife told the staff how much he loved Frank Sinatra. When they played Sinatra during lunch, John's mood changed. He was happy. Consider Bill, who would often get anxious in the afternoon and want to go see his parents, who were deceased. His wife, Marge, found that if she offered him a cup of tea and a cookie, she was able to successfully divert him from wanting to leave the house. When Marge shared this information with the daycare staff, they found that offering Bill a cookie and tea when he was anxious at the program worked wonders and kept him from wanting to leave the building. Be sure to tell the day program staff about any behavioral problems you're experiencing at home. Together as a team, you can think about what may be causing such behaviors and come up with strategies to deal with them. Some caregivers have found it helpful to make notes at home whenever difficulties arrive so they can remember to share it with the staff.
There are times, part of the issue is when getting dressed in the morning, and what my mother will do is be very resistant. Probably because in an effort to save time, what I do is I pick out one outfit, put it out, and say, put this on. And I think she resents that after a while. And I was complaining about this fact to Mary, the nurse. And she suggested something, and sometimes it's something as simple and as easy, and I don't know why you don't think about it, but it's one of those aha moments where she said, well, why don't you put out two things and let her pick between the two of them. And I thought that was brilliant, and it works. And so that's what I do. Other kinds of strategies was, yes, the fact that I have no, quote, background in this, understanding what this means, what the process of the disease is, giving you an idea in terms of what to expect or not to expect. Those kinds of things have been very helpful.
Walter is the primary caregiver for his wife, Denise.
She was uncomfortable in her bra and was hurting or whatever, but she still wanted to wear one. So it was a search, a daily search to go to different places to find the right bra. And then we finally decided, and Mary Catherine helped out with that you don't need one. So that's the way it went, and everything was solved.
Caring for someone with Alzheimer's disease can be an emotional roller coaster. It's hard to keep up with the changes in functioning and personality that occur. Caregivers sometimes report that their loved ones' abilities and understanding fluctuate from day to day. Sometimes these changes are so significant that it's like the person they knew is no longer there. Instead of having a chance to grieve such a tremendous loss, caregivers are called upon to take on even more responsibility. Spouses need to learn a new role as they take on all the daily chores that their partner normally performed. Adult children have to juggle their caregiving with time for their job and their own families. Retirement plans are put aside. Walter's wife was 54 when she was diagnosed.
To be honest, we did not see any symptoms. We knew something was wrong. Even when Denise was diagnosed, we were stunned. Now looking back at things, knowing more about Alzheimer's than we did at the time, it does make more sense. But we were shocked when that diagnosis came through. At first it was hard. We had to kind of teach ourselves and our kids. Our kids fortunately a little bit older, but that didn't make it any easier. But because Denise was so young, there was nothing we could relate to. And we couldn't find anything for her to do
I think when my mother came to live with me 8 years ago and the doctors said she could no longer live on her own, I don't think I realized at the time what a hard job it would become.
Emotionally, well, I became resentful at times that I had no life. And I think that's the biggest thing. You feel trapped. That any caregiver or anybody taking care of somebody that has an affliction, a child, an adult, you lose me time because you're focused on taking care of the person that's, I hate saying that, you have mental issues with the dementia. They can't think. You have to think for them. You have to dress them. You have to help them bathe. I mean, toward the end, when he became real bad, I had to get him every other day into the shower. Otherwise, he wouldn't bathe. I mean, it's hard.
Everything was sort of topsy-turvy in that sense. So I did become resentful. And so it affected me in the fact that I felt burdened. Everything was falling on me. It was sort of, how was I going to negotiate all of the responsibility that it took to continue to keep this train, as I call it, this train moving along the track in a successful way without falling into the ditch.
Feelings of guilt may haunt many caregivers. They feel they're not doing enough or they're not doing it right. They feel guilty because they've lost their patience. How can you not be angry or frustrated when someone asks you the same question 20 times in 15 minutes? How can you not resent being kept awake night after night by someone who just refuses to lie down and go to sleep? Often it feels like dementia patients are doing things on purpose. It may seem they're just being manipulative or inconsiderate.
I find her doing things that frustrate me, but I know she doesn't mean it. But at the same time, I do get frustrated. I'm not going to lie to anybody that's a caretaker. You will. But, it passes because you have to realize that she has no intentions of upsetting me or being slow or going to the bathroom 800 times. It's just a part of the day. In her mind, she thinks she has to go. So.
And it was hard for me to move him around sometimes when he couldn't move. He moved slow, and I guess that was the dementia. And so to get him to kind of speed things up, or after the prostate surgery, he became incontinent. And with that, I really needed help. That was the straw that broke the camel's back. I couldn't move him. And I found that my level of frustration went through the roof. And then I realized he really doesn't understand what I'm asking him to do. And so once I realized that, it changed my behavior. This whole scenario was a big-time learning process for me.
Many caregivers experience grief long before their loved one dies. This is a normal part of the caregiving experience. You may experience many different emotions and may not recognize them as part of the grieving process. These emotions include loneliness, anger, frustration, and sadness. It can last for years and change as the disease progresses. It's important to know that there is no right or wrong way to grieve. Your grieving journey is very particular to you. At times, you may grieve for the person your family member used to be. You may feel the loss of not having the retirement you planned, or feel alone on your anniversary because your husband has no recollection of your wedding. You may miss being able to get advice from your mother. No one can tell you how to grieve, but we can tell you that your journey of grief is sacred and an integral part of your unfolding relationship with your loved one.
My husband was the type of person that he knew before he really declined, he knew that he was declining, because he said to me, "I can't believe this is happening to me." And I said, "What?" He said, "Once a man, twice a child." And that hurt me. For me to know that he knew that and couldn't do anything about it, it was hard.
Well, it was quite a blow because we had a lot of plans for when I retired. He had just retired. He had retired several months before that happened before his stroke happened. And it looked like all of our plans were gonna just, have to be changed.
The way I coped with the change in my relationship took time. I felt bad that I was losing my partner. I went back to my vows, my wedding vows, in sickness and in health. And that was the stimulus for me to do whatever I could to make him comfortable under the circumstances. I felt blessed that it wasn't me. I felt sad that it was him. I felt bad that we couldn't live out the dreams that we had for retirement the way we'd like to.
One of the hardest aspects of caregiving is the sense that, especially for dementia caregivers, the sense that they are losing the connection with the person that they're caring for, where that person may become virtually a stranger because of the impact of the disease upon their brain functioning. And many of the caregivers that I talk to talk about that feeling of loneliness, the loss of a partner, the loss of that person that they've loved for 20, 30, 40, 50 years, who no longer knows them, who may look on them as strangers, who may be very angry and agitated with them. And the sense that they're widows and they're not widows. There's a phrase called ambiguous loss that caregivers go through, where their loved one is there but not there. They're physically there but psychologically absent. And that's a very, very difficult situation to maneuver for many caregivers, and it leaves them feeling very bereft, very lonely, overwhelmed at times, and constantly questioning themselves as, are they doing the right things as caregivers?
It was hard because he had been such a rock. Also, I had just finished caring for a mother who had the same disease. And for me, it was I just couldn't believe that life was going to deal me a double blow. And so I just did not want to accept it. There was a low level of anger that was sort of boiling within me that this might happen to me again. So I felt a little sorry for myself, I suppose. But when I got that diagnosis, hard and fast and in black and white, I just knew that he didn't, having dealt with my mother, he certainly didn't ask for it. It wasn't anything that he brought on, so.
In addition to coping with their grief, caregivers may also be struggling with troubling behaviors caused by dementia. Some of the most disturbing are those that are triggered by hallucinations or delusions experienced by their loved ones.
About 3 years ago, Denise had gotten delusions and hallucinations of people doing things or writing notes on napkins, seeing things in silhouettes on the trees and things like that. Emotionally, the hardest part is seeing her when she's obsessed with these delusions, and you can just tell she's in pain and she's petrified, and there's sobs that I've never heard her do before in 40 years. So that's the part that hurts emotionally. You just want that part to end quickly.
Caregivers are faced with so many stressful situations, and this stress can have a significant negative impact on your health. Caregivers are more prone to heart attacks, high blood pressure, and a lowered immune system. In one study, it took caregivers longer to recover from a wound than their non-caregiving counterparts. If you're a caregiver, you won't be surprised to hear that caregivers get less sleep, and the little sleep they do get is not the deep, refreshing sleep that they need. Caregivers are also more prone to depression and anxiety. The good news is that those who utilize services like daycare and respite services experience less stress. When we asked caregivers if they had any advice for people who are caring for someone, a common theme emerged. Here's what they told us.
And at the beginning, you're going to try, I would advise them, do what you can, but don't try and go it alone. I mean, even though you think you can, and you might be able to do it for a while, but you won't be able to do it forever.
I've heard many people say that if you don't take care of yourself, the caregiver can go before the person that has the dementia. And so to really pay attention to yourself, but to also get advocates for you, to make friends and contacts with people.
From what you've experienced and what you've heard to this point, there's no question that caregiving is a very difficult undertaking. But as hard as it may be to understand or believe this now, the caregiving process can, in the long run, bring about positive growth in the caregiver.
I've seen people begin to grow as human beings in being caregivers that are able to tap into talents and skills that they never thought they had. I've been a geriatric social worker for about 38 years now. And one of the pleasures of my job is that I see, especially older women who may have never written a check before, never driven a car, never made major decisions, suddenly by virtue of their husband's illness, have to begin the process of being more independent and realize that they're doing great, that they have a lot of capabilities, and that beyond when caregiving ends, they blossom. They actually blossom through the caregiving process.
I rise to the occasion. I do what has to be done. I manage my time. I managed him, but I didn't manage myself well. And so I'm learning how to do that now.
Maybe a little wiser, maybe a little bit more caring, compassionate, realizing it could happen to me since both my parents had it, and you look at things a little differently. You don't take things so much for granted. Just your memory we take for granted.
It's made me more conscious of the aging process and the fact that we need to pay more attention to ourselves earlier than we do.
I've learned a lot. I've learned to pay attention to the things that are going on around me, pay attention to my reaction to them, and pay attention to what goes on to me physically, mentally, and emotionally, and spiritually as well.
And hopefully it's made me understand what life is really all about and not be as reactive and angry and stuff like that. I think I've become a more patient person.
At times, you may feel that this is happening to you all alone and that no one understands. Always remember that you do have professionals at your adult day program who know what you're going through and who are eager to do anything they can to help. From time to time, the daycare staff may call you or stop to talk with you when you're at the center. They may ask about your loved one, but they may ask about how you are too. They may ask about recent medical appointments or want to know if you were able to contact the agencies they suggested you call. We want you to think of your daycare program as a sanctuary for you as well as your loved one. Talk to the staff, tell them what's going on at home and how you're doing, and know that they care about you, about your health and well-being. Caring for your family member is a challenging journey, but we hope you'll find comfort in the knowledge that we're taking this journey together and that we're here to support you and your loved one every step of the way.